an excellent mix of engineers, optometrists, people having no ophthalmology background, as well as a whole room of ophthalmologists, clinical innovators pitching today. So this is truly embarking on a journey of clinical innovation, advancing to impact with a very different level of force behind it. So on that note, glad to kick off the award ceremony for the second LVPEI, this time in collaboration with the AIOS Startup Challenge. Without much ado, I will request Dr. Rao to make his opening remarks. I know everybody is keen to hear all the encouraging words, but also get to the finalists. So I'm not standing in between you and Dr. Rao.
Thank you. I'm not sure why Ramesh invited a technology challenged person to speak here. My technology is limited to emails and WhatsApp messages and occasionally PowerPoint presentations. When I was thinking about technology, memories go back to the 90s. At that time, the World Health Organization and the International Agency for Prevention of Blindness together launched a program called Vision 2020, the Right to Sight. The aspiration was to eliminate all avoidable blindness by the year 2020, or at least set up a framework for that for the entire world. So there were three challenges they have identified. One is disease control. Second is human resource development, appropriate to control those diseases. And the third is infrastructure development and development of appropriate technology. So going back a decade even before that, in the late 80s when we started our institute, every time any of us traveled to the West, we used to have a couple of suitcases full of spare bulbs and spare parts for our slit lamps, operating microscopes, etc., carrying back. For a year or two, until somebody came up with a big philanthropic gesture, we could not implant intraocular lenses in our non-paying patients because each lens was costing a minimum of $60, $70. That too was a concessional price from the year-end leftovers that the companies had. So from that time on, so much has happened in eye care technology. And India is a very fortunate country today because we have a lot of indigenous manufacturing of both equipment and consumables. The beneficial effect of all that was affordable care, probably the least expensive eye care anywhere in the world. And we can boast also of perhaps being the only country where everyone has eye care available and also affordable because a lot of people get care at no cost. The only challenge that remains to be addressed seriously is accessibility. We made it available, we made it affordable, but we still haven't tackled the challenge of accessibility successfully. For all these, I think technology can provide many solutions, and that's the other thing. The second aspect is how do we enhance quality and how do we enhance reach of care. And for both these, we need expensive technology tools. And it's beyond the reach of many in countries like ours, and even worse in the other developing countries. And that's where some kind of indigenous innovation has to take place, either completely original or through technology transfer from other countries, existing technologies. So some years ago, I think more than nearly 13, 14 years ago, we started having hackathons. An idea promoted by Virender Sangwan, who was with us at that time. He was having a chance conversation at a meeting with Ramesh Raskar of the MIT Media Lab. And he asked Ramesh, why don't you do a hackathon with us? And Ramesh readily agreed. We did the first hackathon at BITS Pilani, Hyderabad campus. Returning from that on the last day, along with Virender, I asked Virender, why don't we have our own technology innovation center? He said, are you sure? Are you kidding? I said, no, let's do it. He said, but where is the money? I said, money can be found. Let us begin to think about it. So a week later, we had our board meeting and I got the board approved. 1% of our budget can be allocated for technology innovation. But fortunately, a week later, one of the board members came and said, I'll fund it for the first 5 years. So the money problem was solved. As I was telling earlier, money is the least of the problems in India. It's finding the right people that is the biggest challenge. So that's how we got started. Then we did a series of hackathons each year in collaboration with MIT Media Lab. Then we had the formal inauguration of the Technology Innovation Center by President Kalam at that time. And several bright youngsters from engineering schools in the country, a few from MIT, came and worked in the Innovation Center. The whole atmosphere has changed with that. Many small and big tools came out. The folding phoropters, the worms, the pediatric perimeter, several of these. And it is continuing. One thing is to come up with the new things. The second aspect that we also try to address is how do we cut down on the cost of consumables that we use with various pieces of equipment, the spare parts, etc. And there again, we created another cell of the Technology Innovation Center that helped us to cut down on the cost of those. So that's how many components have been added. And then of course, with the employment of engineers, technologists as part of our institute's workforce, we've been able to expand into multiple other areas. And I'm glad more recently, Prashant was also bitten by the AI bug, and he's put together a special team for AI in eye health. And we're looking forward to some exciting things coming out of that group. And hopefully that will further strengthen the technology related to eye health. And I'm sure there are many others around the world who are working in the same area. And together we can make a difference. But the interest shown by All India Ophthalmological Society in this endeavor is very special in my view. When we involve large professional societies in such major transformative thinking, everything moves faster. If more of our members in the All India Ophthalmological Society think along these lines, we can have solutions that come out at an accelerated pace. And that will benefit everybody in the profession, and more importantly, all the citizens of our country and hopefully other countries. So I congratulate everybody who participated in the program the past 2 days. And I congratulate the winners in advance, whoever they are, for your efforts. And good luck to everybody. Thank you.
With the pipeline of innovation that's right, truly hopeful that vision for affordability and high quality to be realized.
Can you hear me now? Excellent. Thank you, Dr. Rao. I think, with the pipeline of innovation that's primed, I'm sure we'll be able to realize that vision for quality and affordability together. On that note, I'm going to request Dr. Prashanta to make his opening remarks from LVPEI.
Good afternoon, everyone. First, on behalf of LVPEI Institute, I'd like to welcome you all. I'd like to especially welcome our guest of honors, Mr. Srinivas Rao Garu, Mr. Ajit Rangnekar, Dr. Harbans Lal, and the entire leadership of All India Ophthalmological Society. I'd also like to welcome industry partners, Sadhguru, and all the participants of last 2 days of Startup Challenge, particularly those who are the members of All India Ophthalmological Society and are for the first time participating in such an innovative and a completely new initiative of this society. I like to take the discussion forward from the point that Dr. Rao highlighted, and that is around accessibility of the eye care. I think if I can show you the figures that close to 1.1 billion people live with some or other degree of vision loss, including need for glasses for reading purposes and near work. Today, India being the most populous country of the world, you can imagine the magnitude and the total burden of vision impairment is far, far more than anywhere else in the world. Not in just terms of the total number of people, but also proportion or percentage of the people who are suffering with this problem. And this is particularly important when we try to relate that vision impairment is directly or indirectly linked to several of sustainable development goals. No society can think of achieving development unless we tackle vision impairment effectively. In the past century, there have been several developments in the healthcare sector. But you will realize that most of these developments are restricted to large urban cities or most developed nations. As soon as you move 100 miles away from main towns, you will see that even the primary care is not available. It is estimated that 1 billion people have either no or very limited access to healthcare. And this sadness becomes even more profound when you realize that close to 80% causes of vision impairment can be tackled by such simple interventions as prescription of pair of glasses or performing a very simple cataract surgery. A large majority of these causes of vision impairment do not even require expertise of an ophthalmologist. We can train high school graduates in performing vision assessment, refraction, prescribing and dispensing glasses. But despite that reality, we are struggling with the human resource development. The foundation of LVPEI Institute was based on 2 pillars: reconciling excellence without denying care to anyone who approaches us, regardless of their socio-financial status, and the complexity of the case. And in that endeavor, over a period of time, and based on a very sound public health study, we developed a model of healthcare delivery that ensures availability of an affordable healthcare even in remote rural areas. And now through this pyramidal model of healthcare delivery, we are able to perform the entire spectrum of healthcare, right from health promotion to screening of population and also management of the most complex eye diseases. And right from the very beginning, we also realized that there will be some people whose vision impairment we will not be able to take care despite best available technologies, and therefore adopted rehabilitation of those suffering with incurable vision impairment. The institute was founded on October 17, 1986, and we started our patient care services on June 1, 1987. As we complete 37 years of our existence, we are today present physically in 290 plus locations, primarily in 3 states, the state of Telangana, Andhra Pradesh and Odisha. We have a small presence in the state of Karnataka. As I said, that the whole principle of our pyramidal model is based on a large public health study our group carried out to understand major causes of vision impairment and blindness